At 6 weeks post-delivery from a vaginal, non-complicated delivery, your sutures will have normally healed and your muscles will be able to support an increased load for exercise and greater exertion. To make sure that you are safe, you will be examined by your obstetrician to check your perineum and your vaginal canal to see if all the sutures are properly healed. If you are doing well, you will receive medical clearance to restart exercise, return to work, and possibly to have intercourse. Now let's talk more about ways to exercise safely and effectively recruit your core muscles. To prepare for abdominal exercises, you must first check for a tenting effect. To do this, you want to lie on your back, bend your knees, and then lift your head up. If you see a tenting effect in your abdomen, this means you have a separation in the muscles and you need to help it come back together. To get started with this next level of abdominal exercises, to prevent the tenting effect, you need to perform the hug the baby maneuver, which is drawing your lower abdomen into your spine to activate the deepest abdominal muscle layer. After you activate this and press your belly into your lower spine, then you can add a head lift. If your belly stays flat and doesn't tent, you're ready to move on to more advanced exercises. If you still have the tenting, then you need to work a bit more using the hug the baby technique and the abdominal isometrics. Always check and use the hug the baby technique as a pre-contraction before your bigger movements to get your belly muscles working in a coordinated fashion. Exercising with a tenting effect causes damage and problems down the road. Some other suggestions are using a Pilates ball between your knees to help activate your hug the baby muscles. You can use your hands to push the muscles back toward the center and then proceed with your abdominal lifts. When you perform hug the baby correctly, you will also feel the pelvic floor muscles elevate as they are connected deeply into your lower abdominal muscle. This step must be followed for successful rehab of your belly muscles. Once you can perform this maneuver well for 20 reps, then you will be safe to progress to larger movements. Now we will perform a stabilization progression, building on the deep abdominal foundation you just created. First maneuver will be lying on your back, tighten your abdominals, and then raise your head. You can also add a knee raise and then lower that leg back down. Always remember to hold your abdominals together if you need to with your hands. Next, in the same position, you can extend your leg outward while holding your deep abdominals closed. The next exercise is called bridging. We'll do this with a ball between our knees. You're going to tighten your abdominal muscles and then lift your pelvis up in the air and lower back down. Always try and maintain that abdominal support. The next exercise will be a plank progression. For this, you want to start on your hands and knees with your arms extended a bit further. Squeeze a Pilates ball or a pillow between your knees. Draw your lower belly up and lower your hips down to make a straight line between your shoulders and your knees. Hold for about 3 to 10 seconds, making sure not to lose your abdominal wall control. Only lower as far as you're able to maintain the belly lift. Build the intensity for 5 to 8 repetitions without losing the form. This will help you build strength so you can manage being in a push-up position. People always ask me about cardio functioning. You're allowed at 6 weeks to return to cardio function like walking, the elliptical machine, pushing the stroller. Just be aware to walk at a quick pace to activate your core muscles and strengthen your midsection. Walking slowly causes too much shifting. Continuing on with exercises for strengthening, we're going to do partial squats. For this one, you want to hold the ball between your thighs, pull your lower abdominals inward, and don't forget to coordinate your breathing. So you're going to squat down, stick your bottom out, and then come back to stand. Now we can do a lunge maneuver. To activate your core, you can squeeze a ball between your hands as you step forward, stabilize, and then push back. Next, we're going to do a standing balance exercise. So to begin with, you want to squeeze a therapy ball in your hands to activate your core, shift your weight, and then lift your knee up as high as you can, like you're stepping onto a high step. Hold your balance for a few seconds and then alternate to the other side. This will recruit your deep core muscles in your hip and low back, as well as your pelvic floor. Another strengthening exercise is step-ups. You can face the steps forward or face them sideways. Always hold your core stable and go up and down, controlling your core muscles. Another is called the 90-90 isometric abdominals. So you want to lie on your back, pull your lower abdominals in, hug the baby. Carefully raise one knee to 90 degrees, hold it there, then raise the other knee to 90 degrees. Hold this position for as long as you can without losing control of your lower abdomen. Now to add all the different components together, we have an advanced control exercise. For this one, you're going to tie a resistance band to the doorknob, face the band, and pull back on the band while holding steady not to rotate your torso. You can use several positions to resist trunk rotation and increase control of your abdominal wall. If you feel stable, add a knee lift as you pull the band backwards. Your exercise goal is to build muscle endurance with your abdominals and your pelvic floor engaged. You need to perform a high number of repetitions with good control. Set a goal of about 20 to 30 repetitions of each exercise. Be consistent and focused for best results. There is one final aspect of abdominal wall care that you must not overlook, especially if you've had a cesarean delivery. Remember, your doctor had to cut through several layers of tissues to reach your uterus. These layers need to heal separated from each other so they do not adhere and cause a restricted scar. You can help the healing process and make the scar more flexible for exercise by doing a scar massage. At the 6-week mark, and only when the scar is fully healed, start the massage process as I will demonstrate. I want you to visualize that there are 4 or 5 sections along your scar. In the first section, place 2 fingers along the edge of your scar and then move your scar upward, downward, right, left, and in a rotation pattern, but hold each of these positions for about 10 seconds in each direction. After you finish that first section of your scar, move to the next section and repeat the process up, down, left, right for about 10 seconds each. Continue along the path of the scar. You need to spend 5 to 10 minutes of your day doing this exercise to help prevent the scar from adhering to itself. This will ensure your scar remains flexible in all directions. Remember, do not perform this scar massage if you have scabbing or any kind of openness to the wound. You will feel some tension and stretch, but it should not be a severe pain sensation. Consistency and stability are the key to your postpartum recovery. Always activate your pelvic floor and your abdominal complex to prevent strain on your pelvic girdle. This will prevent incontinence and help maintain your perineal health. There is a lot more information regarding postpartum recovery than we have highlighted in this video. If you have further questions, problems, concerns, issues that are not related to this video, please feel free to contact your physician and get a referral to pelvic health physical therapy. We're very excited to help take care of your postpartum needs, and we have many services to offer you. Thank you very much for your attention, and I hope you have a wonderful time with your new baby.